Hi and welcome to the Balanced Body Hub YouTube channel. Thank you for being here. I thought today we will talk about the knee. So the knee is the middleman between the hip and the foot. So knee and the foot are both very movable, mobile joints, whereas the knee is more there for stability. So if we've got any pain or issues in the knee, this will lead to the discomfort or compensation in the hip or the foot, or the other way around as well. So if we do have any issues in the lower back, hip, foot, it will lead to instability in the knee and then can create pain, discomfort, and also lead to osteoarthritis in the later years. Obviously, we do have other conditions like rheumatoid arthritis and psoriatic arthritis. They are more inflammatory. However, I'm going to go over some exercises to help you with strengthening the muscles around the joints, more into the glute area so it supports the knee, and I will teach you how to get up and down from seated position to help protect the knee joints. So for some of the exercises you're going to need some of the bands. If you can, get little loop bands to put above the knees, or you can get a bigger rehab band and then just tie the knot in it and use it as a loop. It's all up to you. I would say you can either start without the band and progress to the lighter and then medium and heavier, or start with a lighter band and then progress. So if you have arthritic knees or even stiffness in the knees, this exercise is going to be perfect for you. So you sit nice and high so your feet are off the floor. Find a high chair or even on a table, and then just remember what you used to do when you were a child. Just swing your legs forward and back, and then circles and the other way, and just keep going for 1 minute to 2 minutes, and do it daily. So it basically tractions the knees and gets the fluids flowing into the joint, just gets rid of the stiffness. See how you get on. What we lose as we age is our balance and stability, and we start using our hands to get up from seated position, or even pushing away like that, holding our breath, using smaller muscles. What we need to be using is our glutes, so our buttocks, and obviously a bit of the quads and the rest of the muscles in our legs. However, we also tend to go through the tiptoes, which straight away goes through the knee joint and smaller muscles like the front of the calf and the quad. What I would like to teach you is how to get up correctly, which is going to be like an exercise like a squat, but also functionally you'll be able to use it day to day as well. So get rid of the hands, you're not going to be holding on to anything. Put your feet nice and wide so your knees are not knocking into the middle. Nice stable support. Take a deep breath in, and as you start breathing out, push through the heels and come up. And you can use that as an exercise in itself if you can't do a squat. So you're going to hold it up here, breathe in, come down, and then as you breathe out, come up, just a little tap, and then do the same again, just repeat 10 times. You can also use a little chair to hold on to, or a little wall in front of you, or a little table, anything to support you to begin with as you start building the muscles. But the more you use your glutes, the stronger your stability, the better your balance, the stronger your core gets. And as I've just shown, if your knees do drop in when you get up from seated and they're a bit wobbly and shaky, what you can do is put the band just above the knee on both sides, get one of those little loop bands, and then push the knees out, which is going to exercise those muscles that we've gone over in the foot exercises. Push through the heels, breathe in, and as you breathe out, push against the band. Don't bounce like I just did, I was just showing you. You're going to squat down so the knees are pushing against the band. So the next exercise I'm going to show you is to strengthen the muscles on the outside of your hips, which will take the pressure off the inner thigh and the knees on the inside, Also, when you get osteoarthritis, these muscles become really tight and these weaken, so we need to get them stronger. Get the band above your knee, so it's not on the kneecap, above the knee. Hold on to something, so you can hold a chair, table, wall. I've got my couch, and then you're gonna balance on one leg. If not, you can do the same but laying down, and then you're gonna push out and in and out and in. Lead more with the heel if you can, but I'm happy with the outside of the foot. And then just make sure you're standing nice and tall, your belly button's pulled in, abs are tight, and you're just feeling it in your outside of the hip. Then you do 10 repetitions of this one, and then you're gonna push back, so rotate your toes out slightly and push back, so you feel it more in the bigger glute. So push back, and if you're strong enough, you can even pulse at the top there. Okay, give those a go. Like I've just mentioned, when you do have osteoarthritis in the knee, or even weakness in the core, sometimes you get inner thighs that are quite tight. You probably feel a bit of tension if you feel through it. So what you can do is, using the tennis ball, cross the leg over and literally work into the muscle. If you find a tender spot, hold on it. Just wait for it to ease off as you breathe, and then find a different spot, just roll through it and then ease that off. This is probably the easiest way for you to roll through the inner thighs, finding the spots, easing them off. Also, as you're holding, you can straighten and bend the knee. However, you can do the same on the floor, but then if you do have arthritis in your hip joints or lower back pain, it might be a bit uncomfortable.